So tell me how you've supported your staff.
So again, a number of things we did. First of all, right at the beginning of the pandemic, we quickly changed our psychological first aid kit, really just to refocus it so it supported staff with the challenges of the pandemic, and that rolled out very quickly. And we established a staff health and wellbeing line, or a helpline. Initially, we did it internally for our staff.
Yeah.
But what was really a stark at the beginning of the pandemic was the fact that we've seen a change in our the population who was accessing our crisis teams. We've seen an increase in the number of staff who would be working in the adult services, adult physical health services, particularly those who were working in ITU and areas like that.
Yeah.
But also care home staff. So what we did do very, very quickly was roll the helpline out across. We started in North Cumbria.
Yeah.
We did some really, really fantastic integrated work across Northumbria during the pandemic. And again, we're really in a good position to move forward in the future. But we rolled that out. And first of all, we started with the acute hospitals to support the staff in there, but quickly rolled it out to CCGs, to local authority, police, ambulance, but also third sector and independent sector staff, on the basis that we had the expertise, the ability to keep people in work. And that was one of the critical factors at the time, was to ensure we kept people in work so we could provide the services to our populations. And that continues. And we've really developed that now. So we provide both one-to-one support for staff, but we also provide group support. So there have been some of our local colleagues have had serious incidents, so we've gone into the acute trust and supported a group of staff, particularly when they're having to deal with trauma.
Yeah.
And now that's part of the integrated care system resilience hubs. You'll be aware of them. You've stated. So again, we've just linked that in, so they're on dual running. We've got a system where we can support the whole of the ICS and all the partners in there, and again maintain staff's health and well-being.
Okay, so you're essentially providing the service not just for your own staff, but essentially for NHS and social care staff, and colleagues who work in third sector.
Yeah.
Essentially, the whole health family.
Yeah.
Gets support from you as part of the service.
Yeah.